Hi, good evening. My name is Amandeep and my student ID is 442891.
Hi, my name is Paras Mehta and my student ID is 440001. The purpose of this demonstration is to demonstrate the various categories of medical surgical instruments for their reuse through sanitization, disinfection, sterilization, donning and doffing of personal protective equipment. First, we will start with donning, but before that, we have to do an important step, which is hand hygiene.
For the hand hygiene, the rationale behind this is that if there's any pathogen that may be attached or any microorganism that may be attached to your hands, so hand hygiene helps us to get removed of them, and it prevents any direct or indirect transmission of these pathogens which can be inadvertently occur while you are in a clinical setting. So the first procedure for the hand hygiene is to use a towel to open the tap of the tap water. Once you have done that,
It's the hot water.
and the other one, so this way you can temper the water. So once you've done that, you'll effectively wet your hands and take some soap. And we're going to use this much amount of soap, and we're going to lather our hands with this soap. So there are certain steps that we need to follow. First is to gently lather all the surfaces of our hand with soap, and then do this form of hand washing. This is primarily done to prevent to lather the soap in the interdigital areas of our hand. So once you've done that, you do this form of another step of hand washing. This is primarily done to
Remove the
remove any microbes that are present in our nail bed. You can also do it this way as well. So once you've done that, this is another step where you effectively scrub the hands and the web area of the thumbs. Don't forget to scrub it on the soap on the wrist areas of our hand. So once you've done that, this is primarily done for 20 seconds. So once you've done that, we are going to rinse off all the soap under running water. Important step here is to keep our hands pointed downwards in a 45-degree angle to the sink, so that any excess water or the water that is being used to rinse off all the soap, it does not falls back into a retrograde direction, and it can carry the microorganism back onto our forearm. So once you've done that, we will use a paper towel to dry our hands. Once you've done that, we will use another paper towel to close off the taps and effectively discard it in the dustbin.
Thank you.
Yeah. So now we begin with the donning of the personal protective equipment. So the rationale behind it is it prevents any contact from the blood or the body fluids that could be present. So it provides us with that extra protection. So the first step is to wash our hands, that is to follow the hand hygiene. So after we have done that, we are now going to first wear the gown. So the gown effectively helps us to prevent any contact with the splashes that can occur. So it prevents the splash of any body fluids or blood or any disinfectant. So once you've done that, we are going to effectively tie a knot around the neck area.
And this is a tricky thing.
There's also this thread around the waist. We can either tie it at the back or in the front. But the important thing here is to note that the gown effectively covers all surfaces of our body and prevents any that it does, so any spatter does not fall off on our clothes effectively. So once we have worn the gown, next thing is to wear the mask. The mask basically folded from the threads, and the rationale behind this wearing mask is to it prevents any contact with any air droplets or aerosols that can be present in the environment. So it prevents us. The different type of mask, this kind of mask that we are using is a 3-ply mask. So effectively, one other important step is to adjust the nose bridge so that it adapts to your nose. And if you are using a safety glasses, the next step is going to be that. So you wear the safety glasses over adjusting over the mask. So the next step of donning, that is to wear the personal protective equipment, is to wear the gloves. So assuming that these are sterile gloves, so the first step is going to hold the glove on the inner aspect so that it does not contact the sterile surface, that is the outer surface, and gently slide your hand inside the glove. So once you've done that, the important thing is to tuck the sleeve of our gown in this manner so that it slides under the glove and it effectively seals this environment. So once you've done that, we are going to use our 2 fingers and to slide it on the outer surfaces of the gloves on the other side of the hand. And now we are going to effectively slide our hand in this fashion, and then just we are going to similarly tuck all the ends of the sleeve of our gown into it. So once you've done that, this is the effective way of doing the gloving. So now we are going to start with the doffing of the personal protective equipment. The first step of the doffing is to remove our personal protective equipment. That is the meaning of doffing. The first step is going to be removing our gloves. So what we are going to do is just we're going to pinch the glove on this hand, and then we're going to effectively remove it in this way. So once you've done that, we're going to hold it off in one arm, on one wrist, and then we're going to slide our hand under the surface of our glove, and we're going to fold it so that the outer end of our gloves is securely going into it turns inside out. So once you've done that, we are going to effectively throw this glove in the red bin, that is the biohazardous waste. So once we have done that, we are now going to follow the hand hygiene and wash our hands. So now we have washed our hands and followed the hand hygiene. The next step of the PP, of the doffing of the PP, is to remove our mask. So the mask is removed generally by sliding our fingers.
The eyeglasses.
Yeah.
Safety glasses.
Yeah. So the important step before that is to remove the eyewear. So once you've removed the eyewear, next step is going to be removing our mask. And now we have hold our mask in from the threads, and so the outer surface is going to be contaminated and the inner surface is going to be contaminated by your breath. So we are going to effectively throw that in the red bin, that is the biohazardous waste. So once you've done that, we are now going to remove our gown. So the important thing here is to untie the threads of our gown, and now the outer surface of the gown is going to be contaminated. So the important step here is to be turning the inside surface of the gown out so that all the outer contaminated area it is contained in this manner. Once you've done that, we are now going to fold it.
Since it is a disposable one.
Yeah, since it is a disposable one, we are going to fold it in this manner, turning it inside out, and now we are going to throw it in the red bin of the biohazardous waste.
And if it was not a disposable one, then we
are going to reuse it
by washing it and or sterilizing.
By either we are going to first disinfecting by doing the sanitization, that is going to wash it under the detergent, and then we are going to sterilize it using the hot tubes.
Thank you.